friends, myself Dr. Prateek Bapat, consultant neurologist at People's College of Medical Sciences, Bhopal. Today we'll be discussing a small part of a disease called as epilepsy. Epilepsy is nothing but a excessive discharge from the brain which presents as abnormal body movements or abnormal behavior. So we will be discussing three small parts in this epilepsy. That is it curable? What are the treatment options available? And can a person of epilepsy lead a normal life? So the epilepsy is curable. Yes, the answer is yes. What are the treatment options available? There are two types of treatment options available. First, which is most common and widely available, is the form of medicines. You need to consult your neurologist for it and share your experience, share your symptoms with the consulting doctor, and he will analyze the symptoms and thereby prescribe you anti-epileptic medicines. Taking these anti-epileptic medicines will help you to control your seizure episodes. In this way, your frequency of seizures will be reduced, and in some cases, it will be totally gone. So, the second part, what are other treatment options? The second option is surgery. Well, this option is not available for every patient. There are very few patients based on the eligibility criteria, based on the selection of the patient, it is used. Not every patient will have to undergo surgery. So this needs to be clear to all. So a patient with epilepsy can lead a normal life. Yes, the answer is yes. He can lead a completely normal life. Whether being a male, female, he can have normal jobs. He can marry. He can have children. He can lead a completely normal life with some precautions which needs to be taken care of, like consulting your neurologist regularly, avoiding some activities like driving, swimming, avoid going nearby to a place where there is fire, avoid going to near water bodies, avoid climbing any mountains, or avoid any activities where if there happens to be a seizure, life will be put on at risk. So you should be avoiding all these activities. You should not drive. Driving is not advisable. And taking regular medicines. Sleep is very important part. You need to have a proper adequate sleep. And very few patients, when medicines don't control the seizure episodes, in a very selective subset of epilepsy patients, after careful examination, both clinically and with the help of some investigations, they can be taken for surgery. So epilepsy is curable. Patient of epilepsy can lead a normal life. And yes, there are widely treatment options available in the form of medicines, and some patients can have surgery. So I hope my small message is being widespread to all people of epilepsy, and it helps them to lead a good quality of life. Thank you.